Welcome to this webinar about our online Master Nutritional Epidemiology and Public Health. Since 2015, we are already running this program, this master program. This means that we already have many graduates. My name is Rosalie, and as a study advisor, I'm involved in this master since 2015. I do my work as a study advisor with a lot of joy, because I see these students as a very special and interesting group. Today I'll be moderating this session, and luckily I'm not alone. Together with Amanda and Annalene, we will give you a lot of information about the online master, and we'll try to answer all our questions, your questions. Please feel free to post your questions in the chat, and we'll try to answer all of them. Amanda, can you introduce yourself, please?
Yes, of course. Well, my name is Amanda. I'm also one of the study advisors, and together with Rosalie, we guide all the students in this online master, and we also have on-campus students that we also guide. And I do this now for 7 years, and next to my job as a study advisor, I'm also involved in some of the courses of this curriculum, and especially the academic skills.
Thank you, Amanda. Annalene, can you introduce yourself, please?
Yes, of course. My name is Annalene Kuijsten. I'm a teacher at the Division of Human Nutrition and Health in the Global Nutrition Chair Group. I'm a teacher in epidemiology for the major part. My background is in nutritional epidemiology, so I studied here in Wageningen as well. And after my studies, I've done research as well. And now I'm a teacher, and I also teach in some of the courses in this online program.
Thank you, Annalene. In the next 45 minutes, we will tell you a lot about this master program, Nutritional Epidemiology and Public Health. And we have divided our overview into 4 parts. The first part is about the content of the program. Then we'll give you one example of one of the courses within the master program. We'll continue to tell you more about the structure of the program, and then I will give you some information about how to become admitted to our Master Nutritional Epidemiology and Public Health, and some more practicalities. As said before, please feel free to post your questions and answers in the chat. We will have a look at all of them, and we try to answer all of them meanwhile. So of course, when we continue really to the content of the program, we want to know who you are. Where are you from? Where are you living at the moment? And maybe you can also tell us a bit more about your background, including your bachelor's. And it might also be that you're working already, because that also represents our group of students within this master. So let us know what you're up to, where you are from, etc. And on this slide, on this roadmap, you can see where our students are from. And actually, it means that they're coming from everywhere. They're coming from Canada up to Australia, from South America to Europe and Asia. We also have students who migrated, for example, to Europe or to the Netherlands and start doing their master online within the Netherlands. So let me see if we already have some countries coming in. Not yet, but we can come back to that later also. Then I think it's time to go to the next slide, to the content of the program. Amanda, can I ask you to tell you more about that?
Yes, of course. I will tell you more about the content of the program. And I first will start with some characteristics of the program and share some success stories with you. And then I will dive into the topics of the program. So let's build it up and start with our 5 characteristics. So let me start with saying we have a unique program. Not only in the format, which is online and part-time, but also in the content. We are a master focusing on nutritional epidemiology and public health, and here at Wageningen we have over 50 years of experience in that field. So this is really our niche. And the nice thing about this niche is that we can transfer it to an online program that everyone from all over the world can follow. So that really makes our program very unique. Like I said, the program is organized in such a way that you can follow it on a part-time basis. So you can still work next to it or take care of your family. We also have students that have a second master next to it. And yeah, you can do it wherever you want and whenever you want it. So that gives a lot of flexibility, especially in the context of lifelong learning. The next one is close collaboration. You might think an online master, I will be sitting by myself behind my computer and just go through some modules, but that is not the way the master will work. And I hope this evening we can give you a good impression how this master is organized and how we can establish this close collaboration that you have with your fellow students, but also with your teachers like Anneleen, who's sitting here. And also you have close collaboration and guidance by your supervisors and also by a team of study advisors, so with Rosalie and myself. I think the best thing about this master, and that is also something that we hear quite often from our students, is that the master is very flexible. Like I said, you can do it in a part-time way, you can do it wherever you want, you don't have to come to campus. But flexible doesn't mean it's completely free. So there is a specific order of the courses that you need to follow. Every course has weekly goals that you need to fill and to reach at the end of the week. And there is always an exam at the end of the course. And you cannot schedule when you want to do a certain course because there is always a specific time that a course is given. So it's flexible, but it's not completely free. But we will tell you more about that during this webinar. Now, if you complete this master, then you will earn a full master degree. We are internationally accredited, which means that the master degree that you get is equivalent to the one you would get if you study here on campus. So it's the same. Only you don't have to come to campus and you don't have to study full-time, because like you also see on this slide, we expect you to reserve 21 to 24 hours of your week to study. So it's half-time, I would say. Some students, they need a little bit more, others need less. Some, it really depends on the topic. Sometimes they need some more for some more challenging topics. But this is really the average, and we believe this is a realistic number of hours to spend on it. If you complete our master, then you will be busy for 3 to 4 years, and I will also show you later on in the presentation how you can schedule this. When will it be 3 years? When will it be 4 years? And you can study from home. So you don't have to come to campus. You see this nice picture of spring on the campus. We don't ask you to come here, but there will be one occasion in which we will invite you to campus, but we'll also get back to that. Let me share some of the success stories with you. Like Rosalie said, we started in 2015 with this master program. And even the last 4 years, we had over 30 graduates. So in the beginning, the group was very small, but now I think we have about 20 students starting every year. And here you see some of those students. And we want to share their stories with you. So let me introduce all of them shortly. Let's start with Raymond in the left upper corner. So Raymond had already quite an impressive career before he started with his master program. He had a bachelor in statistics, and he was working at the World Food Program, but he wanted more. So he came to us and he started with this master program in Nutritional Epidemiology and Public Health, and he was able to become promoted to evaluation officer. And he recently moved from Egypt to the headquarters in Rome in Italy. Then let's go to Jessica. So she's just below Raymond. Jessica was one of our students from Canada, and she had the wish to become an epidemiologist, and she had a bachelor's in nutritional sciences, and she wanted to do our master program, but she still wanted to continue with work as well. So this was a perfect option for her, and she was able to work with students from all over the world. I remember that she was also in a group together with someone from Australia, and that worked out. They were very efficient because they were working in different time zones, and when one went to sleep, the other one could catch up to work again. Yeah. So it was very efficient. And Jessica did her internship at the Public Health Agency in Canada, and she was able to get a job afterwards. So she's now working there as an epidemiologist. So her dream came true. Then let's go to Anna, because she has a really different career path and also a different background. Anna did a bachelor in food technology and then decided that she wanted to link more with nutrition and health. So she decided to take a linkage program, and she was admitted to our program, and she graduated within 3 years. And during her thesis, she found out that she was really passionate about research. And this was something she didn't expect when she started.
Yeah.
So this was really surprising. So when she graduated, she was certain that she wanted to go for a PhD position afterwards, and she found one. So she's now in Groningen with the Medical Center here in the Netherlands, and she's doing research into cognitive decline and dementia, and in particular looking into factors such as sleep. And she's using prediction models for that. So she's really becoming a researcher in that field. Now the last student or graduate that I want to tell you about is Dimfi. Dimfi has a background in nutrition dietetics, and she worked as a dietitian for some years. And then she also decided that she wants to get more academic knowledge about the field that she was working in. So while she was still working as a dietitian, she also joined a program. And now she's doing something completely different, because she's now a junior epidemiologist, and she's working with the Dutch National Institute for Public Health and Environment, what the Dutch may know as the RIVM. And she's working on the topic of whooping cough. Well, I had to look up what it was. So for the Dutch people that are looking or watching this webinar, that's kinkhoest. That is what she has investigated in this moment. So I think very nice profiles, and this might give you a good impression of the diversity and backgrounds that we have, and also in the kind of jobs that you can achieve afterwards. So that is more about the general characteristics of the program, but let's dive into the content of the program itself now. And I want to illustrate that with the following word, dish. It really fits nicely to the topic. Well, our master program is called Nutritional Epidemiology and Public Health, and we are interested in finding out the health of the population. So that's the last letter of DISH, the health of the population. We want to know why a certain proportion of a population does or does not develop a certain disorder. So we want to look for risk factors that can explain why a certain disease develops in a group, and with that knowledge we can try to prevent a disease from developing and see if we can improve the health of the population. Well, like I said, we are called Nutritional Epidemiology, so we want to know the link between nutrition and health. And in order to find out whether an intake of nutrition is influencing the public health, you need to know how to measure intake. And that is also what you learn within the master. So intake of nutrition, how can you do that in an accurate way? Now you can imagine that if you have intake of food, of nutrition, that it will directly affect the status of the body of the individual. And you need to know more about these processes to explain eventually what will happen on population level. So you will also get some courses about the status of the body, so nutritional physiology, for example. Then we have one letter left, and that is the determinant of health. So we're not only looking at nutrition, but we're also looking at other factors that might explain the health of the population. So you can think of social determinants, or regulations, or factors like sleep or physical activity, everything that can also be of influence of the health of the population. So I hope this already gave you a good impression of the fields, the points of view that we use to take a look at nutrition and health. And besides all this that is gathered in this, you'll also get courses on data analysis and a solid understanding in statistics. And that is also something that I want to show you on the next slide. So I'm not going into detail in the courses or the course names, but I want to show you the kind of topics that you can expect within this master. And that's what you see here. So here you see different blocks with names of topics that will come back in the different courses. So you will get a solid foundation in the epidemiology, but you will also get knowledge of physiology. Also about study design. So at the end you will get knowledge on how to set up a study yourself, how to gather data, how to collect it, how to analyze your data, how to interpret it. And the nice thing about this master is that it doesn't stop there. So also the public health part is also part of this master. So you're also going to look how can we come up with prevention measures, for example. So everything comes together within this master program.
Thank you, Amanda. Yes. Then we continue. Before we really continue with an example of the course, I would like to just illustrate a bit on who is the audience here. And actually, it's quite reflecting also our current study of student population within this online master. Because what I saw in the chat that the students are coming from different countries, like Dutch person living in Tanzania, Denmark, Romania, Dutch, and they have backgrounds in nutrition dietetics, like you mentioned already, in oncology, in medical, becoming a medical doctor. So it's really a very diverse student or audience now. Maybe not living in the country where they are originally from, but also where they initially trained. But that's what we see also in our current study student population. Yes, I think we can continue. I'm not sure now. Yes, Annalene, can you give us an example of one of the courses which you are teaching?
Yeah, so in this program I teach one course in the start of the program actually. It's called Introduction into Analytical Epidemiology and Public Health. And as you can see on the slide, it covers basic principles in epidemiology. So we look in this course on risk factors of diseases, for example. We look at the study designs which are used in epidemiology and public health. And we also look, for example, at basic measures. So how can we estimate or express risks? For example, what is a relative risk of a certain exposure? So a nutritional intake of something related to, for example, cardiovascular diseases or so. So in this course we touch upon the basic concepts in epidemiology and the basic measures that we use, and actually this is one of the basic courses, and within the program you have then also more advanced courses. And one of the most important things in epidemiology is, for example, causality, so that there's really this cause and an effect. So we look also at the temporality of associations that we find, and I think that's the basic principle of epidemiology. So I think this is a very nice course to teach because people have different backgrounds. We start at a quite basic level, but once you have done this course, then you can continue in the entire program.
Yeah. It is actually the second course within our masters. Yeah. And how should I see it when a student follows this type of course, or this course particularly? How does that work?
Yeah, so maybe the next slide. Here you can see in this course and also the other courses that we teach, we have usually a kind of theoretical background. And usually that's done either by knowledge clips or literature, that can be scientific papers, it can be a book, which is all provided in an online environment. So what we have in this course is that we have an online digital learning environment, which is called Brightspace. And in that setting we put our materials that we use for this course online. So you start with a theoretical background that you can study yourself, but then we also apply it in the specific courses directly. So either it can be a discussion question that we post on a discussion board, where you have to interact with your fellow students to think about what you learned. Also making assignments and collaborating together with your fellow students actually. So there are different diverse ways of interacting online.
But if you zoom in on this knowledge clip, what is a knowledge clip?
A knowledge clip is kind of compact information about a certain concept. For example, about risk factors for type 2 diabetes, then you have a clip of around 5 to 7 minutes, which addresses the main risk factors for type 2 diabetes, for example, and we discuss which ones are modifiable risk factors, which ones are more non-modifiables, such as genetics, for example. So that kind of things are addressed in short clips. Usually these are 5 to 10 minutes, and they discuss in those clips. You can just listen to the new concept that you have to learn.
But does this mean that there are no lectures anymore? So when I was a student, or our on-campus students, they have to go to a lecture on Monday morning, 8:30.
No, indeed.
How is
actually
that organized?
that's the other way around. So we have the lectures are actually translated or cut into smaller pieces in chunks that you can easily listen to in your own time, and you can also set your own time better. You can also the advantage of a knowledge clips is also that a topic that you don't understand that well, you can listen to it again and again and again. But indeed, we don't have lectures in this online setting.
Yes.
So you have to do the self-study yourself, so getting the information.
Yeah.
And we do not meet in person, but we meet online.
Yes, I see. So that's actually the flexibility within one of the courses you mentioned. Yeah, yeah. And how is this set up? You mentioned all kinds of different educational methods. So students also have to do sometimes an assignment.
Yeah. Yeah, usually the courses are set in a weekly schedule. So of course this is still a flexible program, so you can do study when you have time available. But usually what I have in my course at least is that I have like weekly assignments. So at the end of the week you can either start on Monday or on Wednesday, whatever you want. But at the end of the week you need to have more or less go through the entire course material of that week to be able to also work together, because there are discussion boards, for example, and you have to react on each other. So yeah, that is kind of the flexibility at the same time being it's not totally free indeed.
Yeah. And how is it organized? Also students do their assignments, individual, also group assignments, and then they get a grade for that, and then they're ready with the course?
Yeah, if they pass their assignments, they're done with the course indeed. Maybe, it's also already on the slide. So in my course, for example, there are two things that they have to do for the assessment. So one is an exam and one is an assignment, and both together account for the mark of that course. And in my course, it's, for example, 70% for the exam and 30% for the assignment, but it could also be the other way around, or there could be multiple assignments in a specific course. Usually the assignment you can, you have a deadline when you have to hand in an assignment. Sometimes there's also a session of peer feedback so that you do it together, or that you already can hand in a draft version where you get feedback upon the draft version, for example. And then you have an exam. And the exam is usually on a set date. It's usually on Thursday in week 4 of each course. And then during that day you have to take your exam. But that's also flexible because you can take it on a time that fits your schedule. So it can be in the morning or in the afternoon or in the evening, depending where you are.
Yeah. But if I go to you, Amanda, how can I do the exam online? I can always use Signal or WhatsApp to chat with my fellow students. How is that organized? I can easily pass the exam, I would think.
Well, we have thought about that as well, of course.
Of course.
No, we use software. It's called Proofster. And that will record your screen in which you're going to make the exam. So you will go to a platform where your exam will become available, and the software is linked to that. So it will record your screen at that site, and you're also recording from your phone, so that there is no suspicious behavior.
Yes, I see.
That can be checked.
Ah,
yeah. And you're not allowed to have second screens or multiple screens open.
Yeah, I see.
And that's the way it works.
Well talked about, yeah. And if I come back to you, Anneleen, you mentioned that it's a flexible study, so it's a part-time study. Do you know of students who also work next to their jobs, next to their studies?
Yeah, I noticed that in the courses, although I'm a teacher of single courses, so I don't see students throughout the entire program usually, so I see them in a single course, but I notice when I look at the online activities that some of them only work in the evenings, or some of them only at the end of the day, or end of the week, I must say, or in the beginning. And I know that also some people have like doing a study indeed, apart from it, of having a family life or working. So yeah, it is really a different population than the on-campus population, because usually they have to divide their time between private or work-related things and their studying time.
Indeed.
So that's also sometimes a bit of a struggle, of course, but yeah.
Yeah, I think we definitely recognize that the students are working next to their studies, and can you reflect on that if a student is also having a full-time job or also having a family next to the job and study, what would be our advice here?
Good question, Rosalie. And this really differs per person, and also what you're used to. Our general advice is reserve about 20 to 24 hours a week for this, and do not underestimate the program, because it's a full master degree, and it's not just an online course that you're taking. It's a master.
Yeah.
And there are some people that can combine it with a full-time job.
Yeah.
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 So I'm not saying it's not possible, but I think you know best by yourself.
Yeah, you need a balance in that, of course. Yeah. So this links, I think, to the next slides, because Anneleen gave one example of one course of 4 weeks, and actually then you go on to, you move on to the next course. So can you tell us more about the structure of the program?
Yes, I will do that, and I will get back to the colored blocks that I showed you before, and that is what you see here. So I'm now going to tell you more about how the curriculum is built up. So here you see the different teams that are coming back within the courses. And here you see a schematic visualization of our first year of the curriculum. So we have 6 periods here in Wageningen, and we have scheduled all the courses in that. And as you can see, you always take one course at a time. And one course lasts then 4 weeks and has an exam at the end. And then you continue with the next course. And all these courses are placed there in a logical order. And that is also why we numbered them. So the course number 2 is the course of Anneleen, for example. So as you can see here, you start with some basic courses in epidemiology. Then you continue with public health. And many of the different topics come back in the first year to give you a good foundation with all the topics. The second year is built up quite a similar way. So you get more courses. We have 16 courses in total. And you see quite some epidemiology courses. So in the beginning, in the first year, you get the basics of it. And in the second year, you will get advanced epidemiology and also advanced methods in there. So we're not teaching you only the basics, but also the state of the art and the newest technologies and analysis methods. You also see some pink blocks in there. Those are the academic skills and the projects that we're going to work on. So in the first year, around December, we have some skills trainings about programming in R, for example, information literacy. And in the second year, we have some nice projects. And a large pink block in the second year is, for example, a grant writing project that you're going to do in a group of 4 other students. And you're going to do that, of course, online, but also 1 week in Wageningen. And I will get back to that later, because that's a really exciting week. The last block is, the last pink block is also a group project that was first your project, Anneleen.
Tell about it.
Do you want to tell something about it, Anneleen, what it's about?
No, yeah, I can if you want.
Yes.
So the second project was like an application actually of what you learn. And it's a project about constructing food-based dietary guidelines, but also what is needed for that. So that's the integration of scientific evidence that we get from our scientific research and how we integrate that and balance that and come up to policy advice. So that's always a really nice project where students really get like the real world experience on working on for example, constructing food-based dietary guidelines, which is not focused on the Netherlands at all. It's focused on every country you want. So you can pick a country, or you get a country where you can work in a group. It's a group assignment, and you have to really deep dive into that country and the context setting, the health problems in that country, and also the nutritional related problems in that country. And then you're going to write new guidelines for that. So that's really exciting, nice project, I think, to work on. And a colleague of mine has taken over this part, but I really enjoyed making that and working with students on that.
Yeah.
It gives always nice new ideas.
Nice.
Yeah, it's a lovely project, and it's then also the last project of the curriculum with courses. Because this, and here you can see the first 2 years, these are filled with 60 credits on courses, and it's divided with 30 credits in the first year, 30 credits in the second year. Well, we are a master program with in total 120 credits, so I'm now going to tell you about where you get the other 60 credits. And that is when you're going to take all the knowledge that you've gathered in these first years and take that into practice for your thesis and an internship. So at the left side you see the master thesis that is also part of our program, in which you're going to do an individual research project guided by one of our researchers. And for the master thesis you do not have to come to campus. You're welcome to come if you want to come, of course, but most of our students do that remotely. And I want to sketch to you how that works, and Annelien will also tell you more about that when she gives an example. But most of the times our students, they receive a data set, and they have their own research question, and they're going to use that data set to answer that research question, while being supervised remotely by the supervisor from our university. That master thesis is worth 36 credits, which is equivalent to 6 months of full-time work. But I will later on also show you how you can schedule that. Well, after finishing the master thesis, you can continue with an internship or a research practice. And the internship you can do, well, almost everywhere, as long as it has a link with our study, so with Nutritional Epidemiology and Public Health. And it should be at academic level or comparable with the first job that you could get after graduation. And you can do that everywhere. It can be in the Netherlands, it can be abroad, it can be at a company, a health institute, an NGO, another university. So there are many options to go to. But you can also decide to go for a research practice, which is kind of similar as a second but a smaller thesis. It has some different learning outcomes, but if you want to do another research project with our university, then that is also an option. And that is worth 24 credits, and that is equivalent to 24 ECTS.
I see, Amanda. Thank you. Still, I'm a bit puzzled with this thesis and the internship. You mentioned that the thesis you do at the university, but of course these are the online master students. So, Annelien, can you give us an example how this looks like for an online master student or thesis student?
Yeah, actually it looks quite similar as to an on-campus student, supervision-wise. So you usually have like a starting conversation with a student about, I'm also, by the way, I'm also thesis and internship coordinator, so I talk to a lot of students and also help them to find a thesis if they cannot find it themselves. What we usually have, we have in our online learning environment, we have like all kinds of thesis topics that could be interesting for them. So that's a kind of career opportunity or a list of topics that you can look at to see, okay, oh, that looks nice to me, and I usually discuss that with students, what they would like to do and what they would like to learn. So you have, with the student, you have a meeting with students, discuss on what they want to do, and then of course, yeah, this is a master thesis, so you're also always do some kind of data analysis, especially if you're also doing epidemiology, then data is quite important. So indeed, what Amanda already told, then usually you get a data set, you explore the data and to see, okay, what kind of questions could I answer with this type of data that we have. And it also depends on the study design that has been, where the data are coming from. So you have to apply certain methodologies for certain study designs, obviously. So then you start the first part of your thesis will be working on making a proposal, that you write your research question, but you also do some literature research about the topic that you're interested in. to really understand, okay, what is the gaps in the information that we want to find and what we would like to answer. And then the first part of your thesis is around like background information gathering. There's a part on data, not only data analysis, but also, for example, data cleaning, looking at descriptive data, what kind of statistic will I use, and so on and so on. And then you're in the data phase. Then you have done your analysis. You have some nice results. Usually, this goes up and down. Sometimes you don't find directly what you wanted to find, or you have struggles with the type of information that you're lacking in your data, and that kind of things. And then in the end, you write a report, thesis report, where you summarize what you did and also critically reflect upon what you did. Yeah. And usually that's a 6 month if you do it full time, and it can be a year if you do. Yeah.
But you mentioned that there are data sets available. So if I look at one of the topics here for your thesis, this was about fiber intake in relation to survival. So I can imagine you had data from a cohort study?
Yeah, so this was data already collected years before, and actually this is an ongoing cohort, so they're still collecting data in this study. So in a cohort study you have a baseline data, and then you follow up people in time. And every time, every year, every 2 years, there's new data available. Now this cohort, the alpha omega cohort, is for example a cohort in myocardial infarction patients. These are people that already have a myocardial infarction, and we were interested in to see if you adhere to a healthy diet, if you a second event will that take place again, and are there certain nutritional aspects or other aspects in their diet that could prevent a second event. Yeah. So in the first time we look major at the endpoint, myocardial infarction, but in this cohort we also measure diabetes, we also measure kidney diseases, so we measure a lot of different health outcomes in this study, and we do also have a lot of data on the exposure side, so the risk factors and the determinants. Yeah. So looking at, for example, nutrition related things, but it could also be sleep, it could also be physical activity, so there are all kinds of things we measured in such a cohort on which you can do a study question.
But what I understand from this is that the students always have to use a data set provided by Wageningen University, or can they also bring their own data, for example?
Yeah, if they have, they can, So if they have their own data, and these data have good quality, because we do have to know where these data come from and what is the population, how is the population recruited, for so to say. So there are certain quality aspects, of course, but they can bring their own data set if they want, if they have, because data are really nice to have. So I think there are many staff members that are willing to supervise a thesis bringing their own data. Yeah.
And then when we make the next step, before we really see how it would work time-wise, the other part of the master is the internship. Yeah. What does it mean to do an internship, according to you?
For me, the internship is really, it is similar and not similar as a thesis. So, but you are starting to work in a really work environment. So that could be in any place that does nutrition research. It can be an NGO, it can be an institute, it can be a research organization, it can be a university. So in all different kinds of places, you go there and you do your own topic. But that not necessarily is a research topic. What I usually see nowadays is an internship that people participate in multiple projects. For example, here I have put the internship of Jessica, who is from Canada. She did an internship at the Public Health Agency in Canada, and she was she did a few projects actually on monitoring and public health aspects of diseases. So what she did, for example, is looking at now you have type 1 and type 2 diabetes, for example, and these are two different features of a certain, they have similarities, but they also have discrepancies. And how can policy be made to distinguish between those two, and then they had all kinds of grey data. So she was also looking at how can we better define it so we can make a better estimation of how many people have type 1 diabetes and how many people have type 2 diabetes. That was one project where she spent like 20% of her time on, but she was also involved in 2 other projects related to type 2 diabetes. So one was related to the sexual differences between men and women, for example, but also on diabetes and comorbidities. So people having diabetes, they also often develop other diseases. And how often is, for example, diabetes also related to kidney disease? Or if you have diabetes, do you also develop cardiovascular diseases? And by studying this helps to give insight in how a public health agency can base their or adapt their policies actually on real data.
Yes,
so that is kind of
yeah.
Totally different setting.
Yeah.
Usually it's more applied, but not necessarily. So you could also be at a university and doing a similar research as a thesis.
Yeah.
The other major important difference, I think, is for thesis and internship is that in an internship you also focus on personal learning goals. So you also reflect more upon yourself and how you work as a person. So you have learning goals that you set up yourself, like working in a team or about networking, about presenting. So you also, the academic skills that you train, you also try to develop them further during your internship specifically.
It prepares you for your next career step. And what if students already work next to that, then they still have to do an internship, of course, but how do you have some experience on how they manage to combine it next to their job?
Yeah, so sometimes depending on where they work, they can actually do an internship in the place they work, but that's, it should of course be linked to the nutrition and epidemiology and public health. So sometimes they can spend a separate part of their time in that institute where they already work and doing their internship there. That's not possible for a thesis. So that is the option for doing an internship in that sense. And also I see a lot of international students especially who do not live in the Netherlands. They have an internship in the country that they're located in. So then that's also what I often see. Of course, that's not a must, but yeah.
Good. Nice. Very nice to hear about all these different combinations. Well, Amanda, you've told us about all these courses which students follow within the first 2 years, but how the time schedule looks like for students? Can they also change to a more full-time on a full-time basis? And can you show that?
Yes, I can show that. Yeah, how you schedule your thesis and your internship, it really depends on what you want, what you desire, and also your supervisor, of course. But you have the option to switch to completely full-time, stay part-time, like 21 to 24 hours, or something in between, whatever fits you. But if you would choose to go completely full-time, this is what your schedule would look like. So then the thesis will take you 6 months to complete, and the internship will take you 4 months, which means that you are done with the whole program within 3 years. And I showed you some success stories, and half of these students, so 2 out of the 4, they managed to finish within 3 years. But many others, they decide to continue on a part-time basis, especially those that have a job next to it. And then it will look more like this. And here you can see that if you do the thesis based on 21 hours a week, it will take you 12 months, so double the 6 months. And the internship will take you 4 months. Sorry, 2 times 4. So that is 8 months. And that means that you're done within 4 years with this complete master. And then you have earned 120 credits within these 4 years. So let me summarize that for you. So I showed you that all the courses together, they are offered within 2 years in a part-time way. So only one course at a time. It runs for 4 weeks. You have an exam and you continue with the next course. After having completed the courses, you can continue with one of the lovely theses that we offer. And then you can go with your internship. The total duration depends on whether you want to study completely part-time, full-time or something in between, but mostly lies between 3 and 4 years. And we have already mentioned many times, you study from home, you can do it wherever you want, but there is 1 week in which we ask you to come to campus. And that is during the group work of the grant writing project. So that's in the 2nd year. And then we organize the WUR week. And for Rosalie and myself, it's the best week of this whole program because we see all the students coming over. They fly from all over the world to Wageningen. And we have a nice week in which we have gatherings, social activities. We work hard on the projects, of course, but you also meet the teachers. We have lunch every day with the teachers. You get to know Wageningen, you get to know the campus. And it's so nice to finally see the people in person that you've already worked with for almost 2 years. So that's a very lovely experience. And if I ask our students, they always say this is the best part of the master. And also it gives you a lot of energy to continue with the thesis afterwards. And that is also one of the purposes of this week, because what we try to do is to link you with some of our researchers and have conversations with them, have a chat about possible theses. Well, so it's a very nice experience. So there is 1 week in which we ask you to come to Wageningen, and here you see a photo of a few years ago. We also had a lovely group coming over. So that was about the structure of the program. If there are any questions, please feel free to ask them to us now.
Yeah.
And well, I think I give the word back to you, Rosalie.
Yeah, thank you. Excellent, Amanda and Anneleen. We continue to the admission and some more practicalities, because you've heard now many stories, also those success stories at the start of our webinar, and you've seen that students are coming from having different backgrounds. So what makes you become admitted to our online master? And it actually means that you need to have a relevant bachelor degree. What does that mean? When you have a background in nutritional sciences or nutrition dietetics, we've mentioned before, or for example biomedical sciences or medicine degree, or health sciences or gezondheid en leven in the Netherlands, then you can easily become admitted to our online master. But there are some more conditions here, because you also need a good average mark, at least a GPA of 70% or 7.0, depending on where you're from. We take that into account, of course, so it reflects into those 70% of the GPA. Next to a relevant bachelor degree and a good average, you also need to show your proficiency in English. And for that, I really refer you to the website, because there are all kinds of tests, English tests, or whatever school you did to show that you're proficient in English. So do have a look on the website. You can also always email us at, there are 2 email addresses mentioned, but one I mentioned here. This is mnh@wurt.nl. You can send an email to that email address, and we can answer all your questions over there. Meanwhile, you also have seen maybe in the chat 2 links to our website. One is the link to the course catalog. From there you can go to our master and you can have a course description from each course, what we've been talking about. And one is the other website referring to the link of scholarships, because often we get questions about scholarships, and all the information is on that website, which is mentioned in the chat right now. Let me see. Make sure that when you're interested in applying to this master, that you apply in time. The deadline for that is the 15th of June. That's a very strict deadline, so make sure that you're in time. You can apply via StudyLink. There's a Dutch word, StudyLink, studylink.nl. So let me summarize. If we go to the next one. Anneleen and Amanda, you have given us a lot of information about this online master, and I would like to reiterate a few things here. It's really a unique program which is designed for part-time students, where you can, for example, combine work and study, or family, work and study within this context of lifelong learning. The courses take place in the first 2 years, and then you continue with a master thesis and also an internship in this master. And during the courses you work together with your fellow students who also become your friends, what we see during the work week. You also work together with your lecturers, with the tutors within an online environment. So the emphasis within this master is really on epidemiology, what both of you told us, and public health. It's not only the theoretical part, but you really get hands on how to perform your epidemiological data analysis, which study design is applicable to your research question. And also from there you can move forward to the public health, also to the policy part. So in summary, our program offers you a flexibility in which you can decide when you study within the weeks, of course. Let me check whether I have some more questions. Meanwhile, yeah, there's a question if you don't have a completely relevant background, bachelor background, then it's good to still apply for our master, because I know that the admission committee always has a look in detail for each application file individually, and tries to see whether you could be offered a linkage program or pre-master program. These are the same words. That would mean that that you first need to follow some courses, and once you have finished those courses, then you'll be able to start with this master. And one of your success stories from Anna was a good example from this. So does that mean if you don't really have a very relevant bachelor, that you can still become admitted, or first have to do this pre-master? And yeah, of course, that's a relevant question, whether this pre-master is online. And yeah, might be that we have to disappoint you here, because 1 or 2 courses might be on campus, but I think that goes too much in detail and depends on your individual situation and background, of course. So my recommendation would be to apply and see what are the possibilities, whether you become admitted directly or whether you will be offered a pre-master or linkage program. I think that's it for now. We've talked a lot, and we've come to the last slide, which is also one of the pictures made during the work week. And I would like to thank you for watching. I would like to thank Amanda for telling us everything about this master, Anneleen for telling more about how it is to follow a course, but also how to do the thesis and the internship. It might be that we haven't answered all your questions, we know that, but you're always welcome to send us an email to the email address mentioned on the slide. Of course, there's a lot of information on the website as well, but please feel free to contact us. We always answer your emails. So I wish all of you a good evening. Here it is an evening, or good morning, good afternoon for everybody. And we hope to see you somewhere back. Thank you.